So I suppose before I give you some of the background and the situation, I think the first thing to say to many people who are rightly very frustrated, in many cases very angry and finding it very difficult to get their treatments and their prescriptions is an apology from me. Absolutely, it must be very difficult when you desperately needed your medication or you desperately need a review and you quite simply cannot find a solution to do that. It must be enormously frustrating. The problem, of course, is we have gone into a COVID situation where we have actively kept people away from primary care and from the hospital generally. And many people will recall about 2 months ago we had a cluster of cases in the dental department, for example. So by definition, healthcare settings are high risk. We've been trying to keep people away. So that meant that we had to increase our telephone services. And a number of other government counters were closed down. And so many government officers very kindly came to help primary care. And at one point we had over 20 people who came to help us, particularly in the repeat prescription service. As we've moved out of COVID, of course, all of those government officers have been redeployed back to their parent departments because they have their jobs to do and they have their restart programs to do. And while we were very grateful for their help, we clearly can't keep them because they are dedicated to elsewhere. And we reached a crisis about middle of July, where we lost all of our help, and we went back essentially to a pre-COVID staffing level in the prescription unit, for example, but with a post-COVID surge in demand. So many people hadn't seen their doctor for a long time. Many people were running short of their prescriptions. Many people who were on long-term prescriptions were given 2 or 3 months more than we would normally give. So if you maybe have a maximum of 12 months, they were given 14 or 15 months worth.
But shouldn't you have anticipated this and prepared for it?
Well, we certainly anticipated as best we could, but of course it all just came very suddenly. All of the restart was such that everybody kind of was snatched back very quickly. So I think you're right to say we should have anticipated it better. But suddenly all of these members of staff, and I think I'd certainly say that we were guilty of perhaps not being fully aware of the demand of the level of demand post COVID. Lots of people are very keen to see their doctor again now. Quite rightly, they'd like to see their doctor again and have that face-to-face contact and be reassured that their GP hasn't essentially forgotten about them or hasn't lost track of what's going on.
So I think the question that people want answered is, what are you doing to improve the service? Because there's a lot of frustration with the fact that people can't see their GPs and at the very least even get through to a phone line.
Yes, so this is a combination of things. So firstly, yes, we are increasing the resources. So we have been very kindly offered some more government officers because there is a huge backlog we need to deal with. So we are getting more staff as of next week. We've redeployed some of our GHA staff into those areas as well to answer phones, to answer the emails, and many people I think have sent emails that have essentially been lost in the ether almost. People are wondering why their email hasn't been replied to, so then they're sending another and then another. So we'll have people replying to that one. I've dedicated extra GP time, so many of my GPs are doing extra work to catch up on the backlog. I've also dedicated locum GPs to concentrate purely on repeat prescriptions. We are reintroducing the MyGHA, which is the digital telephone service again.
So when will people be able to see an improvement to the service?
Okay, so resources have been coming online over the last few days. We have certainly been keeping track of the disappointment, I think, and frustrations through social media. So we have resources which are coming back online. As of Monday, we'll have more staff in the PPAU, for example. We've increased the number of face-to-face appointments with GPs. Where by the middle of next week, we'll have the digital telephone system up and running again. But bear in mind, even that is not going to allow you to book an appointment, say, 3 weeks in advance. Because in 3 weeks from today, I don't know, if you book an appointment today, I don't know whether perhaps you've got COVID symptoms and you represent a risk, and I can't then screen you. All I can say is please be patient with us just a little bit longer and be reassured that we are absolutely doing our best to solve the problems.